Hi class, Dr. Fife here, and today we're going to cover cancer biology and epidemiology. And let's start out with some cancer characteristics and terminology. A tumor, now this is considered an abnormal growth that's resulting from uncontrolled proliferation, and it serves no physiologic function. This can be considered a new growth or a neoplasm. A benign tumor is usually encapsulated and well differentiated. And a malignant tumor has rapid growth rates and specific microscopic alterations, including loss of differentiation and absence of normal tissue organization. There may be anaplasia, which is a loss of cellular differentiation. Cancers are named according to the cell type from which they originate. Carcinomas arise from epithelial tissue. Adenocarcinomas arise from ductal or glandular structures. Sarcoma arise from connective tissue. Lymphomas are cancers of lymphatic tissue. And leukemias are cancers of blood-forming cells. Classifications of tumors. We can have carcinoma in situ, which is a pre-invasive epithelial malignant tumor of the glandular or squamous cell origin. Carcinoma in situ lesions can remain stable for a long time and progress to invasive and metastatic cancers, or they can regress and disappear. These can be considered high grade or low grade, and the high grade have the highest likelihood of becoming invasive cancers. There's tumor markers, which are specific biochemical markers of tumors, substances produced by benign and malignant cells that are either present in or on tumor cells, blood, spinal fluid, or urine. This includes hormones, enzymes, genes, antigens, and antibodies. And these are used in three ways: to screen and identify those at high risk for cancer, help diagnose the specific type of tumor in individuals with clinical manifestations relating to their tumor, and to follow the clinical course of a tumor. The biology of cancer cells, there's transformation and differentiation. Cancer cells behave differently than normal cells. Transformation, there's a process by which a normal cell becomes a cancer cell. Autonomy, the cancer cell's independence from normal cellular control and is part of the transformational process. Transformed cells, unlike normal cells, lack contact inhibition and continue to crowd, eventually piling up on each other. Cancer cells are usually immortal and that they seem to have an unlimited lifespan. Cancer cells often show defects in the normal process of differentiation. And anaplasia, there's an absence of differentiation. Cancer metabolism, cancers often must grow in hypoxic and acidic environments. Cancers can extract nutrients from the bloodstream. Cancer stem cells, there's ongoing proliferation of tissues with high turnover rate, depends on regeneration from adult stem cells. And adult stem cells have two characteristics. They self-renew and they are multipotent, or they have the ability to differentiate into multiple different types of cells. This is just showing the differences here in the normal cell and the cancerous cell. Oncogenes and tumor suppressor genes, the accelerators and the brakes. We have passengers and drivers. Some mutations can contribute to cancer progression. These mutations are drivers as they drive the progression of cancer. Not all mutations in cancer contribute to the malignant phenotype. Some are random events and are referred to as passenger mutations. Oncogenes, mutant genes that in their normal non-mutant state direct synthesis of proteins that positively regulate or accelerate proliferation. We have tumor suppressor genes that encode proteins that in their normal state negatively regulate or halt proliferation. A proto-oncogene, this is an oncogene in its normal non-mutant state. Gene changes that occur in cancer, mutations of normal genes into oncogenes. There's point mutations, which are small-scale changes in DNA. A point mutation in the RAS gene converts it from a regulated proto-oncogene to an unregulated oncogene, an accelerator of cellular proliferation. Activating point mutations in the RAS are found in many cancers, especially pancreatic and colon cancer. Chromosome translocation and copy number variation. The chromosome translocations are large changes in chromosome structure in which a piece of one chromosome is translocated to another chromosome. These translocations can activate oncogenes, and one of the best examples is the T814 translocation that is found in many Burkitt lymphomas. Gene amplification occurs. That's another type of genetic abnormality that can activate oncogenes. Amplifications are the results of duplication of a small piece of chromosome over and over again. We have tumor suppressor genes, and these genes, their main function is to negatively regulate cell growth and prevent mutations. They may slow the cell cycle, inhibit proliferation resulting from growth signals, or stop cell division when cells are damaged. One of the first discovered tumor suppressor genes was the retinoblastoma, or RB gene. RB is mutated in childhood retinoblastoma and in many lung, breast, and bone cancers as well. Cancer, there are cancer-prone families. Genetic events are the primary basis of carcinogenesis. Most of the genetic and epigenetic alterations that cause cancer occur within the somatic tissues during the lifetime of an individual. Mutations present in the germline result in transmission of cancer-causing genes from one generation to the next, and it produces those families that have a high incidence of specific types of different cancers. Cancer families demonstrate that inheritance of a mutated gene can cause cancer. Inheritance of one mutant allele in these families predisposes a person to a specific form of cancer. Different examples of this include retinoblastoma, Wilms tumor, neurofibromatosis, inherited breast cancer, and adenomas of the colon. Types of genes misregulated in cancer, alterations in pro-growth and anti-growth signals. Multiple genetic hits are required for the evolution of full-blown cancer. Cancer cells must have mutations that enable them to proliferate in the absence of external growth signals. To achieve this, some cancers acquire the ability to secrete growth factors that stimulate their own growth, which is autocrine stimulation. Cells also receive anti-growth signals and can halt unregulated cell growth. There's angiogenesis, in which cancers develop their own blood supply to deliver oxygen and nutrients to those tumors. More advanced cancers can secrete multiple factors that stimulate new blood vessel growth, which is considered neovascularization or angiogenesis. Inflammation, immunity in cancer. The immune system protects us against viral-associated cancers. However, they do still occur. And viruses associated with cancer include HPV, or the human papillomavirus, Epstein-Barr virus, Kaposi sarcoma, herpes virus, and hepatitis B and C. Cancer of the cervix and hepatocellular carcinoma account for about 80% of virus-linked cancers. Inflammation is a cause of cancer. Inflammation and immune responses may create a local environment in which cells can develop into malignant phenotype, and they may benefit progression and spread of malignancies. Chronic inflammation predisposes to cancer. Some of the organs that are more susceptible to cancer from chronic inflammation are the GI tract, prostate, thyroid gland, pancreas, bladder, pleura, and the skin. Chronic inflammation promotes continued proliferation. Inflammation, immunity, and progression of cancer. Cancers disrupt the normal environment. They initiate or enhance inflammation, and they recruit local and distant cells such as macrophages and lymphocytes. Successful tumors appear to manipulate cells of the inflammatory and immune responses, and the tumor-associated macrophage promotes tumor survival. Cancer invasion and metastasis. Metastasis is the spread of the cancer cells from the site of the original tumor to distant tissues and organs. Metastasis contributes greatly to the pain and suffering that patients have from cancer, and it's a major cause of death. Cancer that is not metastasized can often be cured with chemotherapy, surgery, and radiation, usually a combination of those. Invasion or local spread is a prerequisite for metastasis, and it's the first step in the metastatic process. Tumors that are encased in a capsule must break down the capsule in order to initiate a local spread. Transition from local to distant metastasis requires cancer cells to invade local blood and lymphatic vessels, and there's stimulation of neoangiogenesis and lymphoangiogenesis. The transition, metastatic cells must survive in circulation. They attach in a new appropriate new microenvironment, and they multiply to produce an entirely new tumor. It should be entirely. And here's just showing a picture of the different areas of cancer and the likelihood of spread to different areas of the body. Clinical manifestations of treatment of cancer, diagnosis and staging. We're going to look at the location of the cancer. It can determine the symptoms by causing a physical pressure, obstruction, and loss of normal function to that area that the tumor is affecting. Staging cancer, this determines size of the tumor, degree of local invasion, and extent of metastasis. There's a 4-stage system, with carcinoma in situ regarded as a special case. Stage 1, the cancer is confined to the organ of origin. Stage 2 is local invasion. Stage 3 is regional spread, such as to the lymph nodes. And stage 4, the cancer has spread to different sites. There's also the TNM classification system. T indicates tumor spread, N indicates node involvement, and M indicates presence of distant metastasis. And here's just more information on the stages of cancer. Now, treatment generally consists most of the time of a combination of chemotherapy, radiation, and/or surgery. All chemotherapeutic agents take advantage of specific vulnerabilities in target cancer cells. There's antimetabolites, which block normal growth pathways in cells, sensitivity to DNA damaging agents, sensitivity to folic acid and asparagine deprivation. Generally, the patient will need to be treated with a chemotherapy cocktail. Drugs are used in combination designed to attack the cancer from many different weaknesses at the same time. Induction chemotherapy, there's shrinkage and disappearance of tumors. Adjuvant is done after surgical excision of a cancer, and the goal is to eliminate micrometastases. And neoadjuvant, which is given before localized treatment, such as surgery or radiation. Radiation therapy, this is used to kill cancer cells while minimizing damage to normal structures. Ionizing radiation damages cells by imparting enough energy to cause molecular damage, especially to the DNA. Damage may be lethal, potentially lethal, or sublethal. Radiation produces slow changes in most cancers and irreversible changes to normal tissues. And so each tissue has a lifetime maximum dose that it can tolerate because we want to prevent those irreversible changes to the normal tissue. Surgery, this is often definitive treatment of cancers that do not involve spread beyond the limits of surgical excision. It's indicated for symptom relief as well. And it plays a role in cancer prevention and high-risk diseases, such as familial adenomatous polyposis, or patients getting a prophylactic mastectomy to prevent the onset of breast cancer. Okay, cancer epidemiology. Avoiding high-risk behaviors and exposure to carcinogens can prevent many types of cancers. Lifestyle behaviors, dietary, environment, and occupational exposures contribute to many cancer cases and deaths. Lifestyle choices, nutritional intake, smoking, and alcohol use all can contribute to cancer development. The environment, exposure to sunlight causing skin cancers or radiation causing different types of cancers. Lack of physical activity and being overweight or obese. Sexual practices can increase risk to stuff such as HPV, which can increase the risk for cervical cancer. Prescribed and illicit medications, and socioeconomic factors that affect exposures and susceptibilities. And there's carcinogenic substances in the air, water, and soil that can lead to cancer. Genes, epigenetics, and tissue. Cancers are caused by environmental lifestyle behaviors and by exposures and genetic factors. Cancer is driven by genetic alterations and epigenetic abnormalities. Cancer development and progression involves the tissue microenvironment or stroma. The root cause of cancer is more than inherited or acquired genetic mutations. It involves epigenetic changes that frequently precede and induce cancer-causing genetic mutations. If early epigenetic alterations can be detected and reversed, then cancer may be prevented. In utero and early life conditions can expose babies to types of cancer or risks for cancer. Prenatal exposures, parental exposures before conception can contribute, and exposure to breast milk can affect children as well. Developmental plasticity is the degree to which an organism's development is contingent on its own environment. There's abnormal DNA hypermethylation in cancer, and it's noted in many genes important to embryonic development. Chemical exposure to something like DES and the development of reproductive organ cancers. That's an example to think of there. Moms who are given DES to prevent miscarriage early on in pregnancy often their offspring end up having reproductive organ cancers later on in life. Environmental lifestyle factors of smoking. Cigarette smoking is carcinogenic and remains the most important cause of cancer. It's the single most preventable cause of death and disease, and we need to highly encourage our patients to not smoke. Half of all long-term smokers die prematurely from smoking-related causes. Tobacco increases the risk of cancer of the lungs, sinuses, larynx, pharynx, esophagus, mouth, stomach, pancreas, bladder, uterus, cervix, colorectal, ovaries, and acute leukemia. There's also an issue of secondhand smoke, in which we have environmental tobacco smoke, and it can be considered either side stream or mainstream smoke. Smoke is found to have over 4,000 chemicals in the mainstream smoke, 250 of which are toxic, and 60 are considered carcinogenic. So that's exposure to a lot of different toxins. Non-smokers who live with smokers are at the greatest risk for lung cancer because of that secondhand smoke. Environmental lifestyle factors, we have other factors such as dietary sources. Dietary sources of carcinogenic substances include compounds produced in cooking of fat, meat, or protein, and naturally occurring carcinogens associated with plant food substances, such as alkaloids or mold byproducts. Dietary components can act directly as mutagens and interfere with mutagen elimination. Humans are constantly exposed to a variety of compounds termed xenobiotics that include toxic, mutagenic, and carcinogenic chemicals. The two main defense systems for counteracting the effects of xenobiotics are the detoxification enzymes and antioxidant systems. Obesity is a risk factor for cancer, in particular of the endometrium, colorectal cancer, kidney, esophagus, breast, and pancreas. And obesity is also a poor prognostic factor for several different cancers. Alcohol is considered to be a human carcinogen. It causes cancers of the mouth, pharynx, larynx, esophagus, liver, colorectum, and breast. And there's no evidence that shows any safe limit of alcohol intake. Physical inactivity, there's a decreased risk of breast, colon, and endometrial cancers, decreasing insulin and IGF levels, decreasing obesity, altering inflammatory mediators, decreasing sex and metabolic hormones, improve immune functions, and enhance P450 activities. So that just shows the importance there of physical activity and that it decreases the risk for these types of cancers. And there's also other positive effects that happen with physical activity. Infection, sexual and reproductive behaviors, and HPVs. Infection is an important contributor to cancer worldwide. Some of the notable infections and new cancers are HPV or human papillomavirus, H. pylori, and hepatitis B and C. HPV is the most common sexually transmitted virus. Low-risk HPVs can cause skin warts or condylomata. High-risk or oncogenic HPV can cause cancer. Almost all cervical cancers are caused by HPV, and in particular, the most common culprits there are HPV types 16 and 18. Factors that may increase cancer risk include smoking, decreased immunity, having many children, long-term oral contraceptives, poor oral hygiene, and chronic inflammation. Ionizing radiation exposure includes emissions from X-rays, radioisotopes, and other radioactive sources. A CT scan is medical exposure to a high amount of ionizing radiation. In the US, the annual allowable occupational exposure is 50. Sensitivity to ionizing radiation with ataxic telangiectasia, and the BRCA1 and 2 pathway mutations. Ionizing radiation can penetrate cells and tissues and deposit energy in tissues at random in the form of ionizations. Damage from IR can occur directly, indirectly, or irreversibly. Radiation-induced cancer has latent periods of usually 5 to 10 years, but it can be decades from the time that a person has this exposure to the development of cancer. And finally, ultraviolet radiation. UV sunlight can cause skin cancers, basal cell carcinoma, squamous cell carcinoma, and contribute to the development of melanoma. There's natural and artificial sources. The degree of damage depends on the intensity and wavelength content and the depth of penetration. Skin exposure produces ROS in large quantities that can overwhelm tissue antioxidants and other oxygen-degrading pathways. Uncontrolled release of ROS is an important contributor to skin carcinogenesis. Now, the incidence of melanoma in the US has been steadily increasing. Environmental exposures important for melanoma include 3 or more sunburn episodes, periods of excessive sunlight exposure, long-term continuous sunlight exposure, and UV exposure in tanning beds. And tanning beds are one of the reasons why we see an increase in the incidence of skin cancers, primarily in a younger population that frequently go to tanning beds. They are terrible for the skin. Okay, so that's all I'm going to cover on these topics. Please remember that you're responsible for reading and reviewing all of the content in these chapters. Please let me know if you have any questions. Thank you all for listening and have a great day.